Well, every year, about 800,000 people in the United States have a stroke. The number who will survive depends a lot on how quickly they can be treated. Kim Block joins us now with tonight's Healthline Stroke Awareness. Kim?
Well, thanks, Jeff. We are here tonight with experts from Central Maine Medical Center to take your calls about stroke awareness. So the first thing I want to do is put up that toll-free number full screen so you can take a look at it. It is 1-877-494-6308. We also have a live chat going on over at WGME.com if you have questions you'd prefer to ask on your computer. Now take a look at some of the important things you need to know about stroke, and in particular, pay attention to the symptoms because it really could save your life. Getting to a hospital quickly is absolutely critical when it comes to stroke.
Well, strokes, as the name implies, are rapid events. So usually you can progress over 30 minutes to an hour to a very severe type of stroke.
There are two types of stroke. In one, a blood vessel to the brain gets blocked by a clot. In other more rare cases, a blood vessel ruptures.
In the more common type, where the blood vessel gets blocked, the symptoms usually are weakness on one side of the body, or numbness on one side of the body, or loss of vision. Usually those are painless types of strokes.
And because they're mostly painless, people tend to wait to get care. But the longer you wait, the higher the risk of disability or even death from stroke. It doesn't have to be that way.
And we have treatment that we can do. The sooner they get here, we have treatments available that we can give patients so that we can minimize the symptoms of the stroke.
About 10 years ago, a new drug came out called tissue plasminogen activator, or TPA, which actually dissolves clots in the brain. But you have to use it within 3 hours of the onset of symptoms. So if somebody waits 2 or 3 hours, they're not eligible for receiving this life-saving drug.
So get to the hospital on time. With medication and follow-up care, stroke patients have a much better chance at recovery than ever before.
All age groups can benefit from rehabilitation and from exercise and from physical therapy to get them back on their feet. The ability to recover after stroke is pretty remarkable for many people.
And joining us now to talk more about this is Dr. Dan Bobker, who you just saw. He is the hospital neurologist at Central Maine Medical Center. We touched on it a little bit in that piece, but one of the reasons people don't rush to the hospital necessarily when they're having a stroke is because they're not feeling that acute pain that you might feel in a heart attack. Does that prevent people from quick action?
Absolutely. Most strokes are painless. About 10% of them will result in a headache, but most of them don't. And people will have a symptom of numbness or weakness, and they'll say, well, I can wait till tomorrow and tell my doctor then. And really they can't. They should be contacting the doctor right away.
So it might be a little bit troublesome. The problem is as it continues and exacerbates over time, that's when you're getting into that dangerous territory.
Right, and we also lose the window where we can intervene with certain kinds of drugs. Like we were discussing, TPA is a drug that has to be used within the first 3 hours after the onset of a stroke. So if you wait 6 hours, then you've lost that option.
Now, one of the pieces of this that I think is also critical is that when you are experiencing these symptoms, some of them you may be unaware of, but somebody else might notice them. So it's just as important for people not having the stroke to know about the symptoms as people who are. Right?
Absolutely. Some patients will lose the ability to speak clearly or understand words, and they'll just appear confused, and they won't know that something's going on. But a family member can say, something's wrong, let's take you to the hospital.
Right, and so that critical, somebody else noticing it too. Now, we talked about some of the risk factors, among them high blood pressure, high cholesterol. If you're a smoker, #1 thing to do is quit, because that puts you at huge risk.
That's the biggest risk factor for people who smoke.
Obesity also a factor?
Obesity, prior strokes, certain heart rhythms, one in particular called atrial fibrillation is a major stroke risk factor. All those are potentially treatable conditions.
All right, we talk about treatment, but we also want to talk about prevention. We just mentioned lower those risk factors when you can. Also, diet and exercise plays a role.
And medications can help with secondary prevention. Aspirin is still a very effective medication.
All right, terrific. Thank you so much, Dr. Bobker. We want to put the telephone number again on our screen, 1-877-494-6308. Again, it's a great opportunity to ask questions, get some wonderful medical advice tonight from our experts at CMMC, or go online, WGME.com.
We
continue now with tonight's Healthline Stroke Awareness. Kim Block is back with some details on why it's so important to call 911. Kim?
Adrian, stroke is the leading cause of disability in the United States, the third leading cause of death, and yet many stroke patients, as high as 80% of them, do not seek help at the first sign of symptoms of stroke. That's really, really important, and it decreases their chances of survival. Now, this is who you want to call at the first sign of those symptoms: weakness or numbness on one side of the body, loss of vision, garbled speech, a drooping on one side of the face. If you wait too long, swelling like this in the brain makes it much more difficult to treat a stroke. Sometimes a stroke patient doesn't realize that the symptoms are happening to them, which is why family members need to know them too. Don't wait. Time is brain.
The care could have got to them a lot quicker. And they need to realize that that's what you need to do is dial 911. Get the ball rolling.
It's just gut-wrenching when someone comes to you, and then when you start to ask them questions about when was the last time you felt well, or you didn't have these symptoms, and you find out it was last night, you just feel, oh, it's just so important for people to realize, rather have you come here and we send you home and be okay than not have that opportunity to be able to do that.
There are a number of things that emergency crews can do in the ambulance that can help save lives, and joining us to talk more about that is Joe LaHood from United Ambulance. It's great to see you, the operations manager at United. Hi, Joe.
Hi, how are you?
Let's talk about that. Why is calling 911 so important, and what can you do to help the patient on the way over to the hospital?
When someone calls 911, it's a public safety access point. It gets services to the community and to the person who needs it. When they dial 911 for a stroke, they'd send an ambulance, and once the ambulance gets there, we have the ability to assess the patient, determine what the cause of the incident is, and be able to treat them. And we can provide oxygen, which helps provide more oxygen to the brain. We can do IVs, we can put them on a cardiac monitor, make sure their heart is working properly, and we can also, based on their signs and symptoms, we can call the ED ahead of time, emergency department, advise them that we have a potential stroke patient, which gets the ball rolling there.
That's what I was just going to say.
Yep.
So what you're really doing is getting the process going, as opposed to having them come to the hospital and then start from scratch. And we know in this case that time is so essential in treating these patients.
Yes, it is. Yeah.
What have you seen over the years? You've been a paramedic for a long time, I know, but in working for ambulances, you've seen cases where this has really been critical.
Yes, and what I've seen is that the earlier call, the outcome is a lot better. In other words, as far as disabilities, I mean, the sooner you get treatment, the better it is. And people so often say, I don't want to bother EMS providers. You're not bothering us. I mean, we're in this profession to do patient care, so call us if need.
So you really do believe that? Because I know sometimes people think if it turns out to be nothing, then they've wasted a lot of time and expenses and resources. But really, for that one life you save, that is important, right?
Yes, it's very important.
Yeah. How long have you been a paramedic, Joe?
I've been a paramedic for about 15 years.
Yeah. And you and I met a while ago.
Yes, years ago.
Desert Storm,
Well,
when
yeah.
Joe is a veteran, so we do appreciate very much your service to our country. But again, in this case, the ambulance care really is critical, and you would not want people to drive themselves to the hospital.
No, do not drive yourselves to the hospital. That's a huge risk, not only for the patient that's driving, also for the other patients or people that are on the road. It's a hazard.
And
call an ambulance.
Yes, and if you're beginning to have numbness on one side of your arm, then behind a wheel is not where you want to be.
No, you
as
don't.
Well.
Yes.
So in particular with strokes, do not hesitate. Call 911. Folks like Joe are right there to help you. Here's our phone number again for our experts here at CMMC, 1-877-494-6308, or our live chat at WGME.com. And coming up at 6, some amazing new technology that connects patients at CMMC to specialists at Mass General Hospital in Boston. It's pretty incredible. So we'll show you that in the next half hour. For now, back to Jeff and Adrian. It is a leading cause of death in the United States and costs about $70 billion in healthcare costs and medication and missed days at work. We are talking about stroke awareness in tonight's Healthline with our experts from Central Maine Medical Center. We want to give you our toll-free hotline to call if you have a question, 877-494-6308. You can also take part in our online chat. It is critical for stroke patients to be seen as soon as possible. A quick diagnosis can really save a life. But what if a neurologist is not on call? If something happens in the middle of the night and the patient needs the option of life-saving medications, and who makes that decision and that diagnosis? Well, that is when amazing new technology comes into play, linking Central Maine Medical Center with Massachusetts General Hospital in Boston.
This is an example of what a stroke looks like. You see this large irregular area over here.
Dr. Dan Bobker is a neurologist at Central Maine Medical Center. A CT scan of the brain is one of the diagnostic tools used to determine if someone has had a stroke and when is critical. If you catch it early enough, a drug known as TPA can help dissolve the clot in the brain that has caused the stroke.
From the time of the onset of the symptoms to the time we give the drug has to be 3 hours. So if you wait an hour or two at home to figure out what's going on, you're not going to be eligible for TPA. So time is brain.
Because time is so critical in treating a stroke, it helps to have a neurologist in the hospital 24 hours a day. But even if one isn't physically here at CMMC, there is one just a click away.
So this is Dr. Schwam from the MGH Acute Stroke Team. Peggy, can you tell me a little bit about the patient?
CMMC has partnered with Massachusetts General Hospital to offer the Telestroke program, 24/7 neurology care using video conferencing and image sharing technology.
So my pager would go off and I would answer the phone and say, this is Dr. Schwam from Mass General. And they would say, this is Dr. Jones. I have a possible acute stroke patient at Central Maine Medical Center, for example.
In this simulation, Dr. Schwan goes through a series of diagnostic measures, asking the patient to perform certain functions.
Okay, Crystal, we're going to hold up your arm now. Try to keep it up. We're going to let go. Keep it up, keep it up. Okay.
Talking with a medical professional in the room and taking a look at the CT scan, which can be almost instantaneously emailed, the neurologist at Mass General can help decide whether to start the TPA.
There's something called the golden hour, which refers to the fact that if you can start treatment within 1 hour of the start of symptoms, you have a dramatically better chance of reversing the stroke completely and having the person return to a normal lifestyle.
And because of the Telestroke program, no patient at CMMC has to go without that option.
And that's really what this program has done, is leveled the playing field for smaller hospitals so that it really has addressed disparities in access to care. So someone living in rural Maine has the same access now to acute stroke therapy that the person living in Dorchester or Roxbury has.
And joining us now to talk more about the Telestroke program is Peggy McRae, who is running the emergency department over there at Central Maine Medical Center. Nice to have you with us,
Thanks,
Peggy. You have treated, am I right, about 20 to 30 patients now using Telestroke?
Yes, we've done consults for about 20-25 patients so far.
And how has it worked?
It's great. It gives us the ability to talk to a neurology resident, fellow, or a neurology attending 24/7. We can do that within minutes of the patient's presentation, shortly after they've had their CAT scan, and be able to consult with them to see if they are going to be eligible for TPA.
Obviously, you have neurologists on call if one's not in the hospital, but they still have to do the commute, and that 20 to 30 minutes could make a difference.
Can make a difference, and this way we have someone readily available to us through the teleconferencing, and that neurologist that we're on the other end of the screen is able to visualize the patient and do the assessment, the neurology assessment.
Now, we were talking about the technology last week when we did the interview. Is it odd to get used to it, to speaking to somebody who's not in the room, or is it comfortable now?
It is comfortable. The first time was a little odd. You just feel a little bit different when you don't have that person right in the room with you. But now it just seems it's commonplace. We're ready. We get the equipment in the room shortly after the patient arrives, and we're used to it, and it's worked really well.
And it does seem to benefit the patients. There are some people who are maybe going to feel a little awkward saying, well, if that neurologist isn't seeing me at the bedside, but there is always someone at the bedside, you for instance.
Yes, there's either the nurses are there and our emergency department physicians are at the bedside. So we're facilitating that assessment with the neurologist on the other end of the camera.
And again, it does level the playing field so that rural hospitals have more access to this.
Absolutely. Everyone in our region, within and Central Maine Healthcare now has access to the same neurologists that we do at Mass General.
All right, and they do it for about 30 hospitals in the New England area, so it's really fascinating. Let's put up the phone number one more time. It is 1-877-494-6308 or our live chat, WGME.com. Thank you so much, Peggy, and our experts from CMMC will be here throughout this newscast. We'll send it back now to Adrian and Jeff.